There we go. My name's Jenna Mayer. I'm the Director of Sales Engineering here at Kyruus Health. I've been here over 5 years. Prior to working at Kyruus Health, I worked at several of the large health systems here in the Boston area where I'm based and where Kyruus Health is based. Our agenda today is to go through an introduction of Kyruus Health, who we are and what we do. Then we'll go through an overview of our solutions. I'll give a live product demonstration, talk a little bit about outcomes, and leave some time for Q&A. So to start with, who is Kyruus? We are a mission-driven organization that is looking to connect people to the right care so that healthcare works better for everyone. We believe a better healthcare system is one that's transparent and accessible and where everyone gets the care they need. We do this by partnering with organizations all across the country and all across the health system spectrum. We partner with hospital systems, medical groups, and health plan brands, all that vary in size and makeup. On our platform, we've powered over 1 billion care searches. We have over 500,000 connected providers. We have over 5 million scheduled appointments and 60 million patient check-ins. All this to say, we are really the nation's leading patient care access platform. And we do this by engaging patients at multiple steps in the care access journey. We want to ensure that wherever patients are searching for care, they are presented with accurate and actionable information. Beginning with online search, we know that patients primarily start their searches for care online. And so we power different experiences to search for providers and locations and different care options, and also the next step of actually scheduling that appointment, which integrates directly into the EHR, including Oracle. We then take the next step of actually reaching out, engaging with the patient when it's time for that appointment, so they can complete pre-visit documents and forms, also complete check-in and payment collection. We also have patient messaging capabilities and in-office arrival management. And the goal there is really to ensure that resources and staff members at the front desk are using their time for patients who really need that extra help at the actual front desk. And the patients who don't can complete their appointment information ahead of time or digitally, and overall avoid paper where we can. And why are we doing this? And it's because patients want it. They're actually demanding access to improve digital access. We know that 35% of consumers will actually switch healthcare providers in order to book appointments online. And we know that 90% of consumers are actually interested in completing those pre-visit forms and providing insurance information online ahead of time to save themselves time when they get into the office. And from the business perspective, we want to fill those open slots. Leaving open slots can cost the health system or practice money. And what we found is that actually 26% of online healthcare appointments are scheduled for same day or next day. And so our solution helps fill those gaps for appointments that are left open or for providers who have additional appointment access. And we do this by really leaning on our core competency in data management. We really believe that robust provider data management is the key building block for this care access strategy. What we do, and you can see this on the visual on the right, is take data sources from multiple different disparate data sources within the health system, put it through our data pipeline, dedupe it, clean it up, standardize it, and put it into our care access platform, which we call Kyruus Connect. From there, we can actually apply business rules and then also be able to view analytics and insights and create additional connections. Once the data is in our platform and cleaned up and you have this really accurate set of data, we then push that out to wherever patients are searching for care, whether that's a website or a mobile app, or even if they call into an access center. We want those same folks on the phone who are helping on behalf of patients have that same accurate information. Care settings, perhaps an urgent care, you need to schedule a follow-up visit before they leave with primary care or any other external channels. So ultimately, what we're doing is optimizing a source of truth in a single source of truth that can power that variety of different use cases. And ultimately, our goal is to improve operational efficiency through those analytics. We can see how consumers are behaving and engaging with that information, and also make business decisions based on that. From there, once we have the data management, we're able to build off of that through different applications, which I'll go through and demonstrate many of these today. But really, the punchline here is that we have the data management and we'll have the accurate data, and we want to make it accessible to patients through different parts of their care access journey. So this also includes reaching patients no matter where their journey starts for care. Our research has shown that actually over 80% of consumers leverage 2 or more online resources in their search for care. So we know the way patients are searching for care is changing. So not only are they looking at their health system website or their health plan to see if the providers are in network for them, they're also looking to Google, Bing, Healthgrades, Facebook. And so we, again, are that source of truth for data. And so we're able to syndicate that same provider and location data out to these places where patients are searching for care. You can see on the right here are sort of the core endpoints that we work with: Google, Apple, Bing, sort of table stakes at this point. Being able to, so when patients are actually searching, we can actually syndicate the provider listing, availability, scheduling information all into Google, Apple, and Bing in that listing. So we'll actually own and manage the listings for our customers. In addition, we also have integration with Google for online scheduling called Reserve with Google, whereby patients can actually schedule an appointment directly from Google. That will directly integrate into the EHR. On the left, we have some other endpoints as well as part of our listings management offering. We have over 100 health plan brands that are part of our network. And so we're actually able to share data across health system and health plan, including provider information, name, photo, languages spoken, and also availability and scheduling. So again, making it ensuring patients have the right information to make informed decision about which care provider is best for them, and also making it actionable by being able to schedule there directly. We also have third-party listings integrations with Healthgrades and the associated companies there: Healthline, Sharecare, and Medical News Today. We also partner with care navigators, and we do have an affiliation with the Veterans Affairs Department to allow veterans to schedule care with community providers. So this is all part of the idea of data management being housed in Kyruus and syndicating out to where patients might be searching for care. And why have we done this? Well, there's a couple of reasons why we are really the leader in this space. Starting with the left and kind of moving counterclockwise. Again, we have that unparalleled accuracy. We gather, cleanse, and augment provider data from multiple different data sources within the health system. So we clean it up, dedupe it, and it's accurate. And then we can make sure it's accurate and consistent wherever that data may be out on the web. We empower your teams with a unified platform to automate updates. We have heard loud and clear from a lot of our customers that management of listings and also reputation management are extremely time intensive and resource intensive. And so we're able to actually automate updates. So when a profile is updated in our platform, it would automatically update in all those listings in Google, in Apple, in Bing, in Healthgrades, et cetera, to save you time from having to go into each different listing and update the data. Our offering also, moving into one vendor there, our offering also includes reputation management. So, if thinking about listings management, once the provider information is out there, the next natural step is how patients are engaging with that listing and how they're responding to experiences with that provider, with that practice, or that health system. And so we'll be working on reputation management as well, and being able to do all of that within the single platform. Now, thinking about AI, we, again, know how patients are searching for care is changing, and how they expect to engage with those search results are also changing. And so we want to make sure that the data provider and location data is really optimized for that, and making it really easily discovered by patients, regardless of how they search, whether it's voice, mobile, or traditional search engines, or ChatGPT, Perplexity. We will have the data there for them. And lastly, I did touch on this. We do have unique access across our proprietary network of payers and care navigators. So all of that's kind of what Kyruus does at a high level and why we do it. Now moving into how this integrates with Oracle Cerner. We have turnkey digital patient engagement solutions. You can see the different quadrants here, which again, I'll do a live demonstration in a couple moments. Starting with the bottom right quadrant, data management. I touched on this already, but where we really start is we update and manage provider records to really gain insights and drive optimizations to understand how patients are finding and searching for care. This, again, integrates with Oracle as well as other data sources. So we basically can combine We'll take data from Oracle as well as a marketing data source at a health system, as well as an HR system, as well as credentialing, and merge all those together to come up with this clean provider record. We then have a search experience. So we really want to support consumers who are searching for care by leveraging natural language searching, filtering, and we have a Kyruus clinical library of over 37,000 clinical terms to help patients find the right providers. What this means is that we essentially allow patients to not only be able to search for providers by provider name or location, but also a clinical term. So they might not know their exact medical diagnosis, but they do know their symptoms. And they might not know the exact medical symptom, but they do know it at maybe a 4th grade level. And so being able to match that up with a clinically appropriate provider, not only makes it so that the patient actually finds the right provider for what care they need, it also makes sure that your business is optimized and providers are seeing the right patients and their panels are full with the right patients. And those who have open slots for those types of patients can be filled. Additionally, we have online scheduling. And this is the goal here is, of course, to increase conversion by integrating appointment booking. So we have real-time availability that comes from the EHR, as well as integrated scheduling comes from the EHR. And all of this is real time. So not only do we want to make sure patients can find that clinically appropriate providers, but we also want to make sure that that provider is actually available for them and that they could actually book an appointment. I think we've all been in the scenario where you find the right provider, you call the health system, and they're not available for 6 months, only to have to start all over. And so we feel very strongly, we found a lot of success around putting that availability right up front to help make patients make that informed decisions and really save them time. And lastly, we have an integration with Oracle for check-in. So we optimize patient throughput with auto-generated pre-visit links, copay collections, and in-office arrival support. And this really saves a lot of administrative time and accelerates patient access. And as mentioned, this is something that patients have really come to expect, is this digital engagement. We have a ton of Oracle Health experience. We are deeply integrated with Cerner Millennium to streamline patient journeys. We have over 50 Oracle Health customers live with our Kyruus Health solutions. We have this entire platform, but we also have the ability to sort of pick and choose components that you would like to go live with. For example, if you're only interested in the check-in or pre-visit experience, that's a possibility versus the search and schedule. And some of the benefits of our integration with Oracle and our general product platform is that we are continuously innovating. And so our product team has an agile methodology where we're continuously and iteratively rolling out new products and new features and modifying them and enhancing them. And we're also taking best practices from across not only the healthcare industry, but also other digital experiences like Amazon and Google to ensure we have the best patient experience. And we're really keeping up with the times. Lastly, we do have an authenticated digital patient experience. So we have an integration where we can embed the Kyruus search and schedule experience within the within the Cerner patient portal. This really enables a seamless consumer experience across all those digital touch points. So whether they're logged in your patient portal or they're looking on your website, they'll have the same information and experience there. We can drive broader consumer digital engagement and foster that loyalty. Make sure they have a good experience as they're searching and seeking care at your organization and coming back again to do the same thing. And lastly, of course, we want to boost appointment scheduling efficiencies for consumers. So overall, we do have that end-to-end solution to meet your unique needs. We have all the features and functionalities on this list I just went over. I'm going to do a live demonstration of some of this here, but always feel free to reach out to Kyruus Health if you're interested in seeing others. But again, our goal is really to ensure that we have that right patient-provider match. We save the health system time, we create efficiencies, and we really give patients that 2025 digital experience that everyone's come to expect. I will now hop over to a demonstration. So now I'm going to start with the consumer-facing experience. So what you're looking at here is our demonstration environment. You can think of a patient navigated to their local health system, or perhaps they moved to a new area and that local health system's website, and they're looking for a new provider. This is typically what you see here, this blue box of find the care that's right for you. This is typically embedded right on a health system's website under the Find a Doc or Find Care tab within the website. And what it allows patients to do is, again, search for that condition, specialty, location, or provider name. I'm going to start typing an example here. As I start typing, we have type ahead functionality that tries to really meet the intent of the patient. So as you can see, it's broken into different categories, whether I'm searching for a condition or a specialty. I'll talk a little bit more about this, but just to orient you to the search experience here. Let me zoom in a bit. So what you see here right away is we have filters. We come with lots of best practices. We have over 150 health systems live with our platform here and our search experience. And so we know from experience what are the most commonly used filters that patients use to search for care. We know that distance, whether it's close to home or work, is extremely important when making a selection when searching for care, whether you're able to book online and whether their insurance is accepted and accepting new patients. So we do come with best practices like using these filters to pin right at the top. However, we also have the ability to add lots of other filters so patients can really narrow down their search and make sure they're finding the right providers in the results. Again, we come with best practices, but these filters are customizable by health system. So if there's a specific data point or parameter that your patients are searching for, you can create that as an easy filter for them. Now you can also see that we have provider profiles in different rows here. So you can see right away a lot of great information about this provider. You can see a photo, you can see some badges with information about her, like she's LGBTQ plus inclusive, she's accepting new patients, she has online booking. I can see her practice locations, and I can also see availability right away. I'm going to hop into her profile to highlight some of the data we have in here. We have so all the data is housed in our backend system called Kyruus Connect, and it's really up to each health system to determine which of those data points you want to show to consumers. So there may be a need to keep some data points for internal uses back at your health system that you might not be appropriate for consumers. But we'll help you build that out. And again, we have best practices and standards. But looking at this provider profiles, we sort of have a two-panel approach here. On the right, again, we have that appointment availability up front and center to make sure that this provider has availability for what this patient's looking for before wasting their time digging into the provider profile. Right away, we have the highlights so that each health system can determine, what are the really top things a patient might be looking for to call that out right away in the provider profile. We have an about section, so a provider bio. We have videos. So thinking about, again, as patients are searching for care, not only do they need that clinical need, but they also have that human element of trying to find that provider that really meets them on that human level. And things like provider bios and videos are extremely powerful on that. We also have the locations where the provider practices. As I'm scrolling, you can see that the navigation bar is pinned at the top, so you could easily hop to another section. We have that provider expertise, insurances that the provider accepts. We have ratings and reviews. And we also have similar providers. So this will present alternative options based on some back-end logic. Scrolling back up to the top, I'm going to hop back over to the search capabilities here to see the power of this. So I just want to start typing, let's say, heart flutters. As I start typing heart flutter, you can see lots of different recommendations here. I might have the symptom of heart flutters. I don't know that I need to say an electrophysiologist. So if I did, I could click that or other specialties or other clinical keywords. But I also see heart flutters, which is what I was going for as a third drop down here. And this is also dynamic, and over time will change as we see how patients are searching and selecting. If we know that patients are consistently, selecting heart health, this would then present more at the top. So again, always trying to meet that intent of the patient and really guide them to that right care. So I'm going to go ahead and hit heart flutters. Now you can see 20 providers have been essentially tagged with this term, heart flutters. So you can see an internal medicine provider, which, this health system has determined is clinically appropriate. An internal medicine provider might want to be the first line of defense for a patient with heart flutters to then triage accordingly. Or an electrophysiologist is also clinically appropriate. And so you can start to see the power of this clinical tagging as you think about your business and strategic objectives. and patient routing. And what I mean by that is you might want to route, say, cough to urgent care or virtual care or primary care versus a pulmonologist or ENT, because we know those pulmonologists and ENTs don't have availability for 6 months and they're a lot harder to get into. Meanwhile, we know urgent care could take them right away. And we also might want to save pulmonologists for more complex patients, excuse me. And so being able to use this clinical routing to present providers based on where you want them to go is extremely important as you think about your organizational strategies. Hopping in to Colin Kelly here. I also wanted to call out a feature that we've just rolled out called Care Teams. And this, again, as you kind of think about how patient access is extremely difficult these days, providers don't have a lot of availability. We've rolled out this idea of a care team where health systems can actually group together providers or perhaps services as a care team. So whether this is NPs or APPs as part of the provider's care team, this is really important, especially, again, as we think about appointment availability. One of our customers who is using this, we have a primary care provider who doesn't have availability until July, but other members of his care team have availability within days. So being able to quickly see that and being able to take action is really critical to what we're trying to do. We want to make all this information really actionable for patients. I'm gonna hop over to another provider to walk through our online scheduling workflow. So again, you can see here the online availability that this provider has. You can see this provider has 10 appointments today, again, across lots of different days here. I can narrow, if I were to select on this, let me hop back for one moment. If I click booking options, you can see I'm prompted to book online. We also always encourage a phone number here, and sometimes health systems also have a contact form as well, but always want to give that call to action and next step for patients. So if I go ahead and click on one of the availability tiles here, I'm now able to narrow down whether I'm a new or established patient. So now I'm thinking about online scheduling and I'm working through that workflow. So I'm an established patient and I'm going to select follow-up. All of these are configurable by provider, meaning one provider could have lots of different appointment types available online through Kyruus and through this unauthenticated experience. Others might have just a couple, like this provider just has one follow-up appointment. So really configurable by provider and determined by each health system. I'm going to go ahead and select a 3:15 appointment. So you can see we have a 3-step booking workflow here. There was a detail section to select that appointment time. There's a date and time step, which it actually skipped for me because I had pre-selected that on the first screen. And now I'm on the registration page. So you can see it's a very simple process. We really want to reduce the cognitive load for patients as they're searching for care, making it very easy and as simple and as few clicks as possible. And so we have this 3-step process. I'm now brought to this patient registration page. This is a Kyruus registration page, and what this is used for, again, this was an unauthenticated experience. So the patient doesn't need to be logged in anywhere to be able to complete online scheduling. So we do need to know some information to send over to the EHR to determine if it's a new patient or existing patient, and then match accordingly. I'm going to go ahead and fill out. I'm going to use the name of my colleague here. I think Sandy, I know you're on the line here. Okay, so I'll complete this. This screen you see here is also completely customizable aside from the demographic information. Lots of our health systems collect different types of information they want to know ahead of time. Things like who's your referring provider, what state you will be in, your insurance, all this information. We also have a email confirmation that patients and just consumers in general are very used to receiving instant email confirmation when you're online shopping or online scheduling anything. And so we have that as well. That will come completely branded from the health system, but just gives that basic information of, hey, you just booked this appointment, you're confirmed for this appointment. That is optional, but many of our health systems do utilize that. All right, so I've now filled out my registration form with some basic information, and I'm going to go ahead and click book appointment. At this point, this appointment would be booked directly in Cerner Millennium in the provider's template, and the patient will also receive that confirmation email. I'm going to be walking through our patient intake process in just a moment, but do want to pause for questions. I'm just waiting for the email to come through. In the meantime, I can show you what the confirmation email looks like. So you can see, hi, Sandy, you have this appointment. You can see the photo and some basic information about the provider. Again, this is completely customizable, but again, just that instant email to ensure that patients know their appointment has been confirmed. All right, let me. All right. So in this case, because we have the pre-visit functionality, this patient would have received a confirmation email with the ability to start their pre-visit check-in or a text to their phone. So in this case, you can see here, I am using this phone here. Hopefully you can all see this okay, because I'm sharing my full screen. So what this does is it's all connected within the system. So we know the patient has an upcoming appointment, and the health system can set rules to say, 5 days prior to this type of appointment, send the pre-visit text to the patient and include this type of information. So it's all customizable by the appointment type and by the practice in terms of what information you want to collect ahead of time. And so we do ask for the patient to verify their information. Let me see here. And we'll verify our zip code as well. So now it's actually asking me some insurance validation questions, so it can confirm if the patient was an existing patient. I had booked a follow-up appointment. So this was an existing patient, so we had some of this information in EHR, so we can confirm or edit the information. We also have the ability for patients to upload images, so they can upload images of their insurance cards. I'm going to go ahead and confirm this. I can add a photo here, so I'll take from my photo library. Here's my insurance card. I'll just use the same one here. In this case, I don't have secondary insurance. They're also asked photos of the driver's license that, again, would upload directly into the EHR. I'm going to skip this for now. Now it's just asking me to, verify some confirmation, some demographic information. I'm going to go ahead and click no change. My address has not changed. Billing address. Let's see, Kyruus Health. So you can see how dynamic this is. Again, based on the appointment type, different types of questions will be asked, or just also general information you might need in the EHR or required to have in the EHR will be asked in this experience. And patients can agree and sign. This is also constantly updating. So if a patient were to continue or stop and maybe they got a phone call and come back later, it would continually save throughout the process. So here we do have the patient's the payment summary. So we do have an integration with Cerner to collect copays from patient. It will update here based on we have information about that patient, or you can edit directly in the EHR. Patients can actually pay with card here, or they can pay later. I'm going to skip. I'm going to pay later. This is a demo environment, so it's not connected at the moment. But I'm going to skip this for now. And you can see I'm all set. I'm now completed my pre-visit appointment, my pre-visit information, and I can check in at the office. We also do have functionality where patients can scan a QR code upon arrival to the office and begin any other additional information they might need to fill in, and really save that front desk time. And just to wrap up with some results here. What we've seen to date is that our online scheduling and digital intake is really attracting new patients. So 40% of appointments that we see booked online are for new patient appointments. So these are patients that would not have been able to book through your patient portal because they don't have an account. And so this unauthenticated experience right from the website is really driving new patient acquisition. Additionally, there's just general increased traffic to the provider directory. And regarding our digital check-in experience, we found that this very dramatically reduces staff burden, streamline operations, and increases those collections with that digital check-in. And patients are loving it. 89% of patient utilization is through that digital check-in, and you can see some other additional information here. Patients are using this very much, and it really saves the staff significant time. We will wrap up here, and you can scan here to learn more about our platform and our digital self-service tools, and feel free to reach out to Kyruus Health. Thank you very much.